Okay. 5, justify why documentation, advocacy, questioning unsafe orders are acts of caring that protects both the patient and nurse's license. 6, internalize the Nursing and Midwifery Council 4 pillars, which include prioritize people, practice effectively, preserve safety, promote professionalism as the standard for every clinical decision after employment. By the end of this lecture, you will all finally understand that caring is not what you just feel. It is what you do, document, and defend as a licensed registered nurse from the minute you take over the world. Now, who is a nurse? Colleagues, let us try and close our eyes or forget the textbook definition of for just 60 seconds. I know as a qualified nurse, we are all very conversant of who a nurse is. But I want, for the purpose of this lecture, I want you to close your mind against that textbook definition. So let us now try to look at who a nurse actually is. The Nursing and Midwifery Council of Nigeria definition, that is the legal answer. A nurse is a person who has undergone accredited training in approved school of nursing, passed the Nursing and Midwifery Council exams, and licensed to practice nursing. What this definition means is that without the license, you are not allowed to answer the professional name nurse or practice as one. Only a qualified and fully registered nurse or midwife is allowed by law to practice in Nigeria. Next, a nurse is the person who makes sure that the doctor's plan or order becomes patient's recovery. Having known who a nurse is, it is equally important to equally understand what a nurse is not. Therefore, 1, a nurse is not a doctor, doctor's help, or errand boy, or lady, as some members of public were erroneously led to believe, which has been further reinforced by the portrayal of such in movies or dramas or films. You know, in most Nigerian films, they kind of portray nurses as just errand boys or errand lady for the doctors, which is not the case. A nurse is a professional in his or her own right, with distinct duty legally allowed by law. However, in the interest of providing qualitative and affordable health care, they had to work in collaboration with other health professionals in the hospital setting, which include the doctors. But that does not mean they are errand boy to anybody. Not anyone in white is a nurse, and legally, in Nigeria, there is nothing like auxiliary nurse. We have this problem of auxiliary nurse that has almost taken over most of the private clinics all over Nigeria. In Nigeria, by law, there is nothing like auxiliary nurse. It's just a creation of some people who want cheap labor. Anyone who has not been licensed by Nursing and Midwifery Council to practice but still want to answer and work as a nurse is just a quack and can be arrested for impersonation. Nurses are not angels. We are still on what a nurse is not. Nurses are not angels. We are scientists with compassion and not matter without boundaries. For our simple understanding, as far as this lecture is concerned, a nurse is a licensed professional who uses scientific knowledge, ethical principles, and caring behavior to assess, plan, implement, and evaluate care, and is legally accountable for patients' care 24/7. If for any reason you remove nurses from a hospital for just a day, what happens is that the hospital stops being a hospital, it becomes building with sick people in it. As a nurse, caring without competence is negligence. Competence without caring is mechanical rendering of service. Let us try to understand this. Now, if you are a nurse and you are not practicing, as expected, as a professional, it can be termed as negligence. Again, on the other hand, if you have the competence, but you are not caring, what you are doing is just mechanical rendering of services, which some of our colleagues try to turn themselves into. Instead of practicing professionally, they are most of the time they wait to be ordered to do something instead of applying their own scientific knowledge as taught to them during their training in colleges of nursing. The 5 attributes of a professional nurse. Now let us try to look at the 5 attributes of a professional nurse. 1, a nurse as a scientist. Because he or she uses nursing process, the ADPIE that I've earlier mentioned. The acronym ADPIE. The A stands for assessment, the D stands for diagnosis, the P stands for planning, the I stands for implementation, while the E stands for evaluation. You are expected to use this scientific method in the care of a patient. Anytime you come across a patient, you are first and foremost assess this patient, then you do your nursing diagnosis. Based on your nursing diagnosis, you plan the kind of care you want to give to this patient, and then after you now implement those your plan. In implementing those your plan, after some time, you try to evaluate whether the action you have taken on this patient has yielded the needed result. If it has yielded the needed result, fine and good. If it has not, then you reevaluate. You now reevaluate and then change another course of line of action so that the patient can better. She can interpret laboratory values as a scientist. The nurse can interpret laboratory values, ECG changes, detect drug interactions. If they were not scientific nurses, doctors' orders would not be beneficial to the patient. Why? Because such order will be carried out blindly, even if it is put in patient, and that will put the patient's life at risk and undocumented. So it is because of the scientific rationale, the scientific way that the nurses have been trained, that they can work effectively in collaboration with the medical doctor to care effectively for the betterment of the patient. Now, equally, the nurse is equally a lawyer in a way, because she advocates for patients' rights. Questions, if I say it's a lawyer, it doesn't mean that she has gone to read. No. She tried to, kind of advocate for the patient's right, questions on safe order, and then document using careful. The nurse's correct documentation or chart will win or lose a court case. This is to tell you that the way you document the care you give to the patient can, at the end of the day, if for any reason the hospital is taken to court, your documentation is capable of saving the hospital. Or if you document properly. But if you document wrongly, it can mean that same hospital lose the case, and then penalty will be awarded against the hospital and you as a nurse. If they were not patient advocate, the patient gets no voice. Yes. Errors get hidden. Families get no explanation. The nurse is equally a teacher. As a teacher, the nurse teaches the patient and the relative how to continue managing his or her condition at home after discharge. For instance, she teaches a diabetic patient how to administer insulin injection by herself at home. She also teaches a breastfeeding mother the best way to hold the child to her breast during breastfeeding. It also teaches her what type of diet she needs to eat to get more breast milk. If he did not or cannot teach the patient or fail to health educate the patient after discharge, there is the likelihood that such patient might go home and relapse. The child might be breastfed wrongly and will lead to malnourished child. It has been estimated that more than 50% of children in Nigeria are malnourished or not well fed, not because of poverty, but also because of wrong breastfeeding methods. The nurse is equally a chief executive, that is a CEO. As a nurse, you should always have it at the back of your mind, you are a CEO, because she runs the ward for 8 to 12 hours because she decides bed allocation, delegates, manage emergencies, prevent chaos in the ward. Without the nurse, hospital become 4 walls with machines and sick patients. There will be no coordination and more deaths will be recorded. Now, let us understand this. Now, it is because of the way and manner in which the nurse, whenever she's on duty, she coordinates the ward, try to make everything, in proper order. That is why there is no chaos. Otherwise, the nurse would be, the ward would be in total mess without the nurse. So, there will be no coordination and more deaths will be recorded. So, without the nurse in the hospital, the hospital is just a forward machine. The nurses hold a hand and continuously reassure the patient or help her to recite the last prayer before death. That is, the nurse who, even if at the point of death, she can still reassure you. In case of Muslim, there are certain prayers that need to be recited as the patient's life is drifting away. And then nurses are expected, that is if they are Muslim, are expected to help that patient to, recite such prayers so that the patient will die peacefully. Now, the nurse detects error before it becomes fatal. Because of constant observation and constantly being together with the patient, as a nurse, you detect errors before it becomes dangerous to the patient. And once you detect the error, that danger is averted. Now, without the nurse, medicine becomes mechanical service. Dying patients become lonely. Errors become fatal. When doctors diagnose and prescribe drugs, nurses rescue and keep the patients alive. For instance, at 3 a.m., when the doctor is asleep and the monitor displayed all vitals of the patient is rapidly going down, it is the nurse who will be the first to notice because she assesses the patients every hour. The nurse is the first to act. That is by starting CPR immediately and gives oxygen and call for help, code blue. In some hospitals, they have a press button where alarm button, which is color coded. And then, station in the call room. Anytime those doctors that are on call are in their call room, once they see the color, the alarm blue, it means there's a serious emergency somewhere. And they quickly